Okay, good afternoon, everyone, and welcome to the Directors Organizational Meeting of the Lincoln City Council for Monday, May 11th. Again, we're welcoming everyone via video conferencing, and we're telling the public that you can access this directors meeting if you want to go on www.youtube.com/LNK or you can go on facebook.com LNK City. So welcome everyone. And I guess we would like to turn to Sony. And Sony, are there any changes to the agenda that you'd like to talk about or, oh, I wanted to say one thing. I forgot. We do have a couple of late additions to our agenda of the Directors Organizational Meeting that I'd like to be added. I wanted to touch base with everybody on the City County Commons meeting that we have scheduled on Monday, May 18th. That should be added to our discussion today. And then also, again, bringing up the discussion about video conferencing on Monday, May 18th. Okay, those are the two things that I'd like to add to the agenda for today. All right, Sunny, do you want to go over the City Council meeting agenda at 3?
Yes, just a reminder, we do have the Memorial Day holiday off, so no council meeting on Monday the 25th. And I would ask for permission if I could call under section 5 under public hearing ordinances and second reading, if I could call items 5A and 5B together since they are related.
Okay, that seems to make sense.
Okay, and then also if it's okay to call items 5E and 5F. Items are not related, but it's by the same applicant asking for the same request to remove the item on pending and have public hearing on 6/1.
Okay. That sounds good. And then I do have that today is one of our public comments days, so that at the conclusion of our meeting, we can ask if there's anyone that has something that they would like to address before us that they can. Okay. I don't see anything else, Sunny?
No, one other thing. I did send out that list of the testifiers, but we do have Mr. Fiala who will be physically here to do public testimony.
Okay.
And his item is item 4C.
4C. Okay, terrific. All
and
right.
That's all I have.
Okay, wonderful. Thank you very much. Did anybody have a comment? Yes, Sandra.
I have a question. Will David Carey be present at the meeting today? Either way, physically or by Zoom?
I believe he plans to attend by Zoom at least.
Okay, great. I would love to have David there if Mr. Fiala is going to be with us.
Okay, thank you. Jennifer, normally we have the mayor's office go first. Did you want us to have Pat Lopez go first?
Yeah, that'd be fine.
Okay, all right, Pat, thank you very much for joining us, and we'd like to hear from you on the updates.
Okay, some of you may have seen on Saturday, we had 79 cases reported. And then in the last 24 hours, we have now had 38 cases. We only had one yesterday. The state's working on some of their reporting systems. Today, we've met with the courts and are providing some guidance to them. We met with corrections and some of the other county agencies this morning and are just working through some guidance. They're doing well with that. Probably 38 to 40% of the increased cases that we're seeing are related to the meatpacking plant in Crete. So we're continuing to work with them. We think that over half, probably well over half of the individuals there have been tested. Probably all heard that Test Nebraska has been stood up out at the event center, the Lancaster Event Center. And that started Friday. So they tested Friday and Saturday, and they're to be there all week as far as I know. the state is working through some issues with the reporting the lab test results getting to local health departments and the individuals. I think they're having some issues with people signing up, so we're just being, cautious, letting them work that out. I don't have any idea of how many people have been tested in Lincoln. I know that there's been testing in Omaha and Grand Island. They're still waiting for their results from those tests last week. We have noticed or heard Omaha has had increasing numbers of cases. They probably had close to almost 300 Saturday and Sunday that have happened. We are waiting for clarification to see where we're at. We had one death last week, and it's we're still on a couple of other situations related to that. We're working closely with the cultural centers, and we're going to be doing some testing Friday using the Bryan Mobile Center at Lincoln High. So that's getting set up. We also identified that for some of our families, it's really difficult to quarantine and isolate because somebody needs to be able to get out and get food and other essential items. So we've now set up some care packages for families kind of when they first go in, and we're working through how we can get them out and share that information with our cultural centers. We do have MOUs with them to share information, but this is a little different situation. So we're just working that through. And then they're working on getting food to the families, and we'll see what else is needed and we can go forward from there. We continue to assist family, women and children that were at the mission at a hotel site here, and case management's being provided by the community action for the women, and they've been moved up on the list for housing. So that's our goal, to get some permanent housing. We've been working with long-term care, both their state associations and some of the sites here locally, to make sure that we have items in place. And we've actually done some calls where we invite health directors across the state and other long-term cares, and that's been really beneficial in kind of sharing at the local level how we can be the most effective. I've been in contact with Director Frakes at the penitentiary, and he's been providing information so that I understand what they're doing there to make sure that we have things in place so our health system wouldn't become overwhelmed. Our new directive health measures went into place today. The directive health measures for Lincoln, one of the bigger differences is from the state. We provided guidance to them and input, but for example, with restaurants, you'll notice that we do require the servers to wear face coverings. And in all cases, we're encouraging any of those, the hair salons, barbershops, all of them to do monitoring the restaurants, to do temperature checking of staff and monitor for any symptoms. Then we, in addition, one of our other major differences is that we're having people clean high-touch services a little more often. That's probably one of the basic differences, and the fact that our measure is going to go till June 30th. I do suspect that the governor, I think if you heard him, has been talking about youth sports, so I anticipate he'll be issuing some remarks about that in the near future, perhaps in the next day or so.
Pat?
Yes.
He's doing it right now during his press briefing.
Is he? Okay. I think it might be for June 1st that he's talking about some limitation. I need to look at the guidance again about that. Let's see. We have, we've got 16 public health nurses now engaged and working. with contact tracing, and we have 11 school nurses that received orientation last week, and we work with them a lot on communicable diseases. So that was a really smooth process, and they are engaged today, starting to work with us, and that'll give our staff, we can balance a little bit better about the pressures on them. I think the mayor will be talking today about some information that the staff has developed looking at several different models like the Johns Hopkins, the Open America Again, and another area to kind of come up with some guidance that the public can look at to see about what actions they should be taken given our current environment. So if you think about it, it'll be like the air advisory dial, like kind of like what you need to do at certain times. So the mayor will be speaking about that with along with Scott Holmes today. And the last thing I wanted to let you know, we have been just with the onslaught of cases. Now we have staff working on the recovery data just to make sure we have collected them all in race and ethnicity. So the goal is to be able to report that on Wednesday.
Okay. Are there any questions for Pat? Richard?
Yeah, Pat, real quickly on these testing guidelines, does the county have their own? Do you still need a physician or somebody to refer you to one of the city or the county's testing stations?
Well, the Sainies and Bryan still require, but you can just go in and do the assessment, Richard. You don't necessarily have to have your private physician do it, but that's one way you can do it. Either that or just go through the assessment online and get approved. And that's the Test Nebraska. There's not any physician involvement with that right now.
But that's two different ways of.
Right.
You need to either do one or the other. You can't sign up for one and expect to go to the other place.
Right. Because the Test Nebraska, you get, I won't say the right word, but it's all done kind of online, and then they send you a message via your phone. And that's what gets you entry out there to get tested. That's how your information is. Whereas the one at Bryan and Sainies, they ask the same exact questions. So there are two ways, the Test Nebraska or this one. If you're having symptoms, you want to get tested as soon as possible.
Right.
Get your results.
You're saying the Test Nebraska was being a little slower.
Right now it is. Yeah, right now it is, but I'm sure that the governor's got a team working on that.
Okay, thank you.
Mm-hmm.
Any other questions for Pat? Tammy?
There we go. Thank you. So Pat, I missed or don't understand what the June 30th deadline is. Is that for restaurants only? Or are we going to look again at local measures, or what is that June 30th?
That's for everything that's in place right now that we're talking about, just keeping all the same measures in place with the hair salons, massage therapy, and the restaurants until June 30th to give us a chance to really look at our data. It's always easier to change the DHM and maybe expand it more, but we thought it would be more realistic for people to have a time frame as we were seeing our number of cases change in that to be able to have something in place that they could plan around. And of course, if our conditions would greatly change either way, we would make adjustments.
Either way. So this is local.
Yes, this is our local.
This is our local deadline, not the governor, correct?
Right.
Okay. Thank you. That's all I had. Thank you.
Okay. Pat, I have a couple questions for you. Can you clarify, because I looked this morning and it said the number of positive cases this morning were 17. And did I hear you correctly? Did you say there are now 38?
Right, and there may be more before the end of the day. The test results are coming in at, throughout the day, and sometimes in the morning, we really don't get any. By the time we do the 8:15 report, we only get a small number of the tests. And since we did that report about an hour and a half later, then we got more reports. And so we're just trying to be as accurate as possible on the website. And we're talking about maybe we just go to a 1 time a day adjustment, but then just know that maybe a state website or something else may say something different than we have. So just because they've just made some of this change and we're not sure what is happening with the lab reporting, we're kind of letting that play out a little bit longer so we can make a better judgment of when to report.
Can you also talk a little bit about the infection rate? You know, we recognize that we're doing a lot more testing and different agencies are testing, but it's the infection rate. Has that gone up? I know initially it was around 5 to 10%, and then certainly this last week creeping up even higher percentage. So have you had a chance to crunch the numbers for today or?
Not for today. I'm waiting to see what we get here in the next, well, probably we'll get another report at 2:25. And so we'll update. But the positivity rate, I think I was mentioning last week, was higher. And we know that we're going to have more positives, but the positivity when we do more testing, but there's that positivity rate that we're looking at as well, balanced by the number of tests done.
And bottom line, we are seeing an increase in that positivity infectious rate.
Right.
Can you talk a little bit? You mentioned in Douglas County. What are they attributing the major increase in Douglas County to?
When I was talking, the health director today reported, I believe, about 30, I can't remember if she said 30 to 40% are related to meatpacking.
Okay.
And they had 2 more deaths over the weekend too.
Thank you. Are there any other questions for Pat? No? Okay. All right, Pat, thank you very much. Thank you again for all that you're doing.
Thank you.
We appreciate it.
Let me know if you have any questions anytime.
Okay. All right. Thank you.
Bye-bye.
Bye. All right, Jennifer.
Following up on what Pat was talking about, obviously we're spending the vast majority of our time working through our incident command structure related to COVID-19. But we're also focused on how we will be viewing summer programming for parks and libraries, and we are making some final decisions this week that we'll communicate to you and the public about our thoughts around those normal services and programs. And then we're also looking at any of the service changes that we've implemented in the last 6 to 8 weeks and trying to determine when we either resume the way we did business before, or whether some of the changes that we have implemented will continue to function the same way or we'll make adjustments. So we're constantly looking at how we, if we change the way we did business, have we reviewed it to see if that's, if we should continue to do that or change it back or continue to do it, but in a different way. I've been in touch with each of you over the weekend about a charge around an economic recovery task force. Thank you to those that sent some suggested names for participation. And we're hoping to put that also together sometime this week. The other part of our work in the last week has focused a lot on the budget. The mayor's getting ready to make some final decisions about what to put in her recommended budget to bring to council in June. And I think we'll be in touch with you about having some discussions before that package gets put together. So you'll probably be hearing from us in the next week or so on that. And finally, today was the day that proposals for redevelopment of the Pershing block were due, and we have 5 proposals that have been turned into urban development. That's all I got.
Great. Are there any questions for Jennifer? Jennifer, oh, Sandra, go ahead.
Hello, Jennifer. I was curious, I know that you've not made a public announcement yet about the Economic Recovery Task Force, but do you know when that task force would begin their work? And I know that you've talked about multiple subcommittees, and do you have any idea about the numbers of subcommittees and when those committees would begin their work?
No, I think that'll be determined when we solidify the chair or co-chairs of the task force, so we haven't made any decisions about that.
Okay. And then how long do you think the task force would be in effect? Is this a year?
I really have no idea. I mean, it could last as long as we continue to look for a vaccine. I mean, the reopening of our economy, if that's the right phrase, I would probably argue that it is not, is a long-term prospect. And so we're trying to figure out how to assist not just these specific businesses that were affected by this current DHM. We've really not closed very much in Lincoln, Nebraska. We have had lots and lots of business happening in the city this entire time. So we're trying to figure out the best way to advise the public and those businesses about how to operate in this, I think what we're calling the now normal, which is until we have a vaccine, we all have to take precautions in how we move about town.
Mm-hmm. Mm-hmm. Thank you.
Mm-hmm.
Richard.
Also, they talk now about a June 30th date. Does that mean we're going to stay with what we have currently? Is that what I heard? So
that's probably a question for Pat and not for me.
Okay, but I was thinking more about all the recreational facilities, the pools, the ball diamonds, those type of things that are closed now.
Yes, for the moment, they would gatherings of 10 people or more, but those gatherings are for enclosed spaces. So we would anticipate that there would be ways for people to be outside, but no final decisions have been made on any of the summer programming or the opening of playgrounds or ball fields.
Okay,
yep.
Thanks.
Mm-hmm.
Jennifer, I have a question for you. The question that I asked Pat Lopez about Douglas County and what's going on in Douglas County. I know that they've made, Douglas County and the City of Omaha made some changes last Monday. And I don't know what you're seeing or feeling. And I know maybe this question should also be of Pat, but how are they trying to isolate what some of the increases they're seeing in Douglas and Omaha County because of some of the changes that they made last Monday? That's one, if you know about that. And then number two, what type of response does the mayor and the administration plan to do should we see a spike more than we see in a spike this past week? How can we, I guess, differentiate between the fact that some of the standards and guidelines have changed effective today, and we see the numbers increasing from even before we sent these new guidelines? How is the administration planning to differentiate between those two? And is Douglas County doing that too?
I don't have any information about isolating increases in Douglas County. I don't really know I don't know how to address that question.
Okay.
If you could explain to me, I don't know what isolating increases means.
Or maybe segregating the increases that are due to changes in some of the standards that the DHMs that they've had in place for the last month and a half. They're 1 week ahead of us on the changes that they've made. So has that been segregated to those new positive cases that are coming, as Pat said, primarily from some of the processing plants? And what are those cases that might be occurring because of the changes in the DHMs that Douglas and Omaha made a week ahead of us?
Well, with regard to food processing facilities, nothing has changed. They've been open the entire time and no DHM changed anything about the operations of food processing plants in Douglas County or across the state. So I don't think it would be, I don't know how we would isolate cases related to food processing in the context of a directed health measure.
I guess guess the number I'm trying to get to is these are the increases in the cases that we're seeing because of the food processing plant and the connectivity, the tracing that goes on. This person had a family member, and differentiating those cases from those that say, hey, I went to the hair salon and last week, and these are the contacts I've had. I'm trying to figure out what's happening because of what. And I know the health departments are very good at tracing and tracking that stuff, but that's one question. And I don't know if you can dig into that and if Douglas County is tracking that. But what is the city of Lincoln and Lancaster County going to be doing going forward day one? How are we going to track and trace those that are the different standards that are now in place? Like somebody can say, oh, well, I went to a restaurant and I came home and 3 days later I'm sick. That's the data I want, if we can segregate the data and what is the cause of that, so that we as a city can respond to what we're seeing. And that I guess that's a question to you as well.
I don't think anything changes. The contact tracing process continues the way that it has taken place throughout this pandemic, and as it is used in all communicable disease contact tracing that the health department does 24/7 for the years that they've been in place. So if someone is a positive case, then our communicable disease team will be in touch with them. We'll do their contact tracing, which was so nicely documented in the Lincoln Journal-Star last week about all the work that they're doing. As Pat mentioned, we have some additional supports from school nurses now that are helping with that work. And I know our department has been putting together a contact tracing manual to train new people that are going to be working in contact tracing, but I don't think the process itself changes. We have been identifying cases in food processing facilities throughout the pandemic. Pat has reported on those numbers related to both the Lincoln Smithfield plant and the Crete Smithfield plant, and the numbers of employees and the numbers of their close contacts and family members that have contracted COVID-19 as a result. So I don't think any of that changes. We've worked very closely with Public Health Solutions, which is the local health department in Saline County, to communicate about those employees, because we know that although they all work in Crete, a lot of them, if I remember the last numbers, and I'm sure they're not correct today, but I think last week we reported 100 employees, but 74 close contacts that were cases traced to Lancaster County affiliated with the Smithfield plant. So we will continue to do that. We've been working closely with those families to try and assist them in maintaining quarantine after they are positive, by trying to come up with supports that will help keep them in their home, to prevent their need to go out to the grocery store or to make necessary trips. So I think our health department is well prepared to move into this next directed health measure time. But again, I don't think this is a major change, because these are a handful of kinds of businesses, but we've had all kinds of businesses open this entire time. Every hardware store has been open, every grocery store, every other kinds of retail shop was never shut down by our directed health measures.
Thank you. I appreciate that. But going forward, how quickly can we respond if we see a spike that is unrelated to those cases that are traceable to any of the food processing plants? How quickly can we respond?
Immediately.
Okay, to make changes to some of the guidelines that we've changed.
Absolutely.
Okay. Thank you very much. Now, are there any other questions for Jennifer? Don't see any hands up. Okay. Thank you very much, Jennifer.
You're welcome.
Appreciate it. Okay. Let's go on and do the boards and committee reports. I think the first one was ISPC. Sandra, did you all meet by any chance?
We did. Thank you very
Okay.
much, Chairman. We met last Thursday afternoon. We met by Zoom. And we had a very short agenda. We looked at the software policy. We made a small amendment and then approved that. I'll come back to that in a moment. We looked at the new cost allocation model between the city and the county for implementing the software policy. Then we talked a little bit about the security awareness trainings that are being provided to every city employee. There was certainly a greater need to make certain that employees had training on how to keep their computer systems safe, how not to fall into security gaps. Not that there are any gaps, but that how we operate with email and Zoom meetings. Each of us also received an invitation to attend security awareness. The goal is to get every single computer that's assigned to the city and the user through security trainings. There will be 6 or 7 modules. I did ask David Young to let us know how we're doing as council members and getting our security training accomplished. And then we discussed work from home and how the changes that are being made, and also right now, just to deal with this, and also going forward, we're going to be looking at policies about work at home and how we might want to put something into place that recognizes that there'll be future emergencies, whether it's, God forbid, another pandemic or flooding or some other natural disaster, and a reason to have folks working at home. And there's no consistent citywide policy for that practice. So we'll be talking about that later. So let me go and just briefly talk about the amended software policy, which will come before us in the next few weeks. David's goal is that we see this on our agenda for a vote by June 1. I think that might not be possible given the calendar we have, but certainly very early in June. It needs to be both voted on by City Council and then the County Board. And this would establish the policy to manage risks regarding all of our desktop computers, our servers, our database, and our productivity software by streamlining how many different software programs that we operate with. And for security reasons, I'm not going to mention them here, and I don't believe when they come before council, we're going to spend too much time talking about the details of the software, just so that we're not broadcasting that. We talked a little bit about how we might get that done. We'll be talking to law and as well as probably to Richard as chair in the 1st of June about we might have those conversations in executive committee so that we maintain our city security systems. And then we talked, of course, about the cost of this and recognizing that the need to be flexible and nimble and to allow us to work at home and to allow us to be efficient means that this is a pretty high priority item in the budget, but there still may need to be a reason to look at how to trim this cost down. I've had a short conversation with Jennifer about that, and the mayor's office does believe that this is a necessary expense. So I don't think we'll be looking at significant cost savings. We're not going to be looking to cut this item. This is critical for us to be resilient going forward. And I've answered any questions because I know I sort of brushed over the top of this, but it will come before us, and I've asked for a council briefing at directors in the next couple of weeks.
Terrific. Are there any questions for Sandra? Okay, thank you very much for a good report. Okay, we can go on to James Michael Bowers for PRT.
Yeah, nothing major for the PRT committee. There still continues to be cases that are being monitored. No cases were added this month.
Okay, that's a good thing. Any questions for James? Okay, the West Haymarket JPA, Tammy.
Yes, so we did meet April 30th by Zoom, and we did have people participate, the public participate via Zoom as well. And that worked well thanks to Jamie's assistance and his staff. It was a fairly light agenda. The most significant item, and you may have heard or read by now, was we did approve a resolution for a right of entry agreement between the JPA and the University of Nebraska. That doesn't give them ownership, but it gives them the right to do some repair on a abandoned railroad bridge. It's at the end of the Haymarket area. So they have, I believe they have till June 30th. It's near the ice rink down the Haymarket by Salt Creek. That June 30th deadline could get extended because of the pandemic, but that was the most significant action we took at our meeting. And we've changed our May meeting date because of COVID and people's schedules for late May, but we'll be meeting again via Zoom in May, unless things really get better before then. So we did deny one claim of a woman at PBA who fell against a curtain and claimed injury, and that was denied as well at the recommendation of city law. So that was the extent of our agenda. That's really all I have.
Terrific. Are there any questions for Tammy? Okay, thank you very much. Let's talk a little bit about, if we could, the May 18th City County Commons meeting. I've heard from a few members on the Lancaster County Board of Commissioners requesting that we delay this. I concur. I heard back from a couple of city council members saying that would be a great idea. So Sean Flowerday, the chair of the Lancaster County Board of Commissioners, suggested maybe we compromise. The next meeting would have been in August. Maybe we push it out to July. And I'm wondering if that's the consensus of the city council. Some of the dates would be July 13th. That would be after the 4th of July. We have July 6th off because of the 4th of July holiday, or July 20th, or Monday, July 27th. These are all Mondays in July. July 27th, we have our evening meeting at 5:30. Does, I guess, is that a consensus of the group that we just hold off and skip the, I see a bunch of people shaking their heads.
Yeah.
I agree to holding off the May. And I think, as I said in my email, June or July
Okay,
both seem reasonable. I don't know that I want to hold until August. I'd like to do this before we finalize the budget.
okay. I think we'll have a really clear indication about where the budget's going. And so should I give the dates of July 13th or July 20th back to the county board? Those are both Mondays. Okay. All right, I will do so. The other thing is, do we want to continue video conferencing? I know that at our last meeting, May 4th, we had a discussion about doing it through the end of May. Sandra had prepared a press release to talk about why we are meeting via video conferencing today. And I certainly would like to hear people's thoughts about it. I know that since last Monday, May 4th, where we had agreed to meet via video conferencing through the end of May, our count of positive cases last Monday was at 394. And today, Pat Lopez said there was additional cases added to the Monday count, and it's not finalized, but we are now at 645. So that's going from, in 1 week, 394 to 645 positive cases. So that is really a big concern to me, to see those numbers going in the completely wrong direction that we need to see, even based on the CDC guidelines of having 14 days of where the numbers are going down. We're seeing our numbers continue to go up, and we're not seeing them plateau either. So that's my thought. So I'd welcome the discussion from everyone that's on board and get their thoughts. Sorry, Richard, go ahead.
Thank you, Jane. I'd be fine with going for at least another meeting because it's just 1 week. And then we can reassess it next week. Look for the June 1st, like we've talked about before. What we do have, though, there are certain items that will be coming forward that probably will need to be, should be meeting in person on at some point here in the near future. But I'm like you, I don't like the rise in these cases. It's kind of going the wrong way. So I'd be fine with, yeah, at least going till June 1 at this point, and letting it go until then. And maybe next meeting we'll make a different decision. But at this point, I think this is the prudent way to go. And I'll know more after we have the meeting today. I'll feel better and see how it goes.
Any other comments on this, Tammy?
Yeah, if everybody else supports that, I also think it's the prudent thing to do. I know we talked about doing otherwise, if the measures have changed, but I too look at the numbers and think it's not a healthy thing to do, regardless of our procedure. So I would support meeting by Zoom if that's the will of those present. I think the numbers speak for themselves. They are surging. We are surging in Lincoln. So I think we need to be mindful of that as we meet as a body.
Thank you, Sandra.
Well, as the author of the press statement, I was, and also the amendment last week, or the amendment that said, if the DHM was lifted, and I realize it hasn't been lifted, it's been eased. But even the easing makes me feel like we at least have to have this conversation in the public so that they know that we are not blithely trying to skirt around a promise to come back face to face. The increase in numbers, almost doubling, is very upsetting to me. And I think that even more so than the doubling is the increasing positivity rate. It does not feel like a very wise thing to encourage face-to-face meetings. I know for myself, I am feeling an even greater need to stay close to home and limit contacts, especially with more people being, allowed to go out or being encouraged to try to resume some level of normal. It just makes me a little bit more fearful of people who may not be taking this as seriously. And I know I am looking for people to wear masks. So if they're not wearing masks, I'm certainly not feeling like I want to be out in the public. I know all of my colleagues here at the meeting have been wearing masks when we're face to face with each other. And so I'm not concerned about my closer association with all of you. But certainly if we don't need to go out in public and encourage a lot of people to come to meetings, I don't think we should.
Thank you. James?
I just want to echo my support in what everyone has said here, and I think that meeting virtually is the right thing to do.
Okay, so I think that is the consensus, but I would feel better if I could just take a roll call vote for us to continue to meet via video conferencing through the end of May, with the recognition that we would like to get back together on Monday, June 1st. So I don't know if I need to restate that, but are we pretty clear? We'd like to continue to meet via video conferencing through the end of May, hopefully with the decision to return on Monday, June 1st in person. Richard?
Yes.
Oh, I thought you had a comment to make.
No.
Okay, all right, so let's go ahead and do a vote, and I'll just do it based on my screen. Tammy?
Yes.
Yes. Richard?
Yes. Yes.
Sandra?
Yes.
Yes, and James?
Yes.
And myself, yes. Okay, so that is 5 votes in the affirmative. I have nothing else to bring up, although, you know, what I would suggest, and I heard Richard had mentioned this, and I had mentioned it as well, after our Metropolitan Planning Committee meeting, that we probably should have Liz Elliott come and give us a briefing. I know that she's arranged schedules for individuals to have a briefing, which is good. But do you think if we arrange for her to give an overall briefing on funding, tracing, tracking for transportation and highway, would you like to see that before our May 18th meeting? Our May 18th meeting starts at 5:30. And if people don't want that, and then I know if they're comfortable meeting with her individually, that's fine too. I just wanted to know if we should have a big tutorial beforehand, and that way when you meet with her individually, you can ask some really good questions. Any thoughts on that? Sandra?
I would like to have a group briefing because I think sometimes it's helpful to have the same information to all of us at the same time. So if we could do that on the 18th, I would like to just double check that the Internal Liquor Control Board is not meeting. We usually meet at 4 o'clock before an evening meeting. We have not been meeting. We have stopped meeting because of this pandemic, but I think we carried on a little bit longer than I thought. But I would, I guess I would say yes. Let's meet with Liz next Monday if at all possible, and I'll get back to you ASAP about the ILC.
Okay. Does everybody feel comfortable that would eat in at maybe starting at 4:30 and go to 4:30 to 5:15 and prepare Liz? Like, we just want the straight data on, you know, funding, where the pots are, how does that flow chart work, and how do we make requests and changes to the long range transportation plan, the transportation improvement plan. You know, I think those are questions that we were left asking. When is the appropriate time in the process? Can we make these changes? Okay, so I'll wait to hear from Sandra, and then we'll see if we can get it scheduled. Okay, so if everybody's good, we will adjourn and come back at 3 o'clock. Okay.
Thank you.